surgery started around 2 years back, where we did do a feasibility with Hosmac, one of the leading healthcare consultants in UAE. We did find a gap in the UAE market in terms of day surgery centers, and along with Hosmac, we did do a planning and did set up the Medstar Day Surgery Center, which is a 20,000 square feet area. We have 2 major operating theaters with our procedure room, 15 beds and around about 10 consultation rooms. We do also have planned for a diagnostic center with our X-ray, mammo, OPG, ultrasound and a laboratory set up over here. So over the last 1 year, it has been a good growth, what we have seen. People have been more positive towards the day surgery center concept, and Medstar has been able to get some of the top doctors to come and operate over here. Doctors coming all over from the UAE, from US, UK, and also from India. So we have successfully completed a number of operations over here on day surgery concept, and we have got a good feedback from our patients, doctors, and everybody with the day surgery concept. Medstar does in future, with this successful model, plans to expand further. We would love to have more day surgeries in the whole of UAE, at least one in every state of UAE, and further look at expansions in the whole GCC. Well, definitely ambulatory centers are, the benefits of it against an hospital are the stay of the patient is shortened. So that relates to less infection rates, earlier recovery, speed of recovery, better comfort for the patients, and overall it's less of cost to the patients for undergoing the surgery in an ambulatory surgery center. UAE being a busy country, and in order to save time, the ambulatory day surgeries are more encouraging, as we have less time of recovery, and also the insurance factor plays a major role, as it's an insurance driven section in UAE, so they would prefer ambulatory day surgery over inpatient day surgeries due to the cost factor. Day surgery concepts are quite new in UAE compared to other developed countries. So initially it would be educating both the patients, the people around, the insurance companies, as well as guidelines set by the authorities. But in the last 2 years, that has been going up and that has been overcome. So those are the challenges what we look at. Well, there are a list of more than 150 procedures which you can perform. Majorly what's happening in day surgery is more of cosmetic surgeries, which we can do, simple ENT procedures, and even minimally invasive procedures like minimal laparoscopic procedures can be done in a day surgery center. In Western countries, it's already developed an ambulatory day surgery. People are aware of it, they're more conscious of it, there is a mindset of doing it. In UAE, it's different. It's still under development and people have to be educated about it. They have to be conscious and aware that they have to go back the same day, and there is no complications in that. They have to understand that the recovery is same as staying an overnight into the hospital. So those are the challenges what we see, and the differences at present between the Western and the UAE country. Yes, as I mentioned before, the insurance companies are looking at reducing their costs. So ambulatory day surgeries or a day surgery center does benefit them in terms of cutting costs and giving better benefits to their patients, their clients. As I mentioned, it is a newer concept which is people around this region are used to an inpatient facility. So the major is educating, and as the insurance companies or insurance policies are maturing over here, it will be changing, and we can see the trend changing in the last 1 year towards more of ambulatory day surgery centers. Well, any changes for the good are welcome, and I think they will take place. But as the regulations from the last 1 year have been more specific for day surgery centers, unlike before, we have different setups for which level of operation theatres to be used in what kind of a setup of day surgery centers. So definitely they have now better set of guidelines for ambulatory day surgery centers. The community-based doctors do have an advantage by operating in a day surgery center. Like for example, in our Medstar day surgery, we do have a lot of community doctors coming and operating. It's an advantage as they get customized treatment for their patients. There is less hassle for their patients, less hassle for the doctors as compared to a big hospital setup or something. The patients get better care, and at home when they are discharged, they are happier to go home earlier, and the community doctors also have a less hassle in following up with their patients during that day.
How do ambulatory surgery facilities cater to the accommodation requirement of international patients?
Well, as per the regulations, most of the day surgery centers do go for an accreditation. As for example, our Medstar is going for a GCI accreditation. So these are based on international standards, and in terms when we are looking at medical tourism, this plays an important role in being accredited and all. And as we are able to reduce the cost, this in turn also attracts the medical tourism to come and get operated over here. Well, competition is there definitely, but as a standalone day surgery center, we do have less overheads, and we can compete in the range of being less cost effective, being better cost effective, I would say, and also since we are a day surgery center, we don't keep patients overnight, and the stay of the patients are less. Recovery is faster. The infections rate compared to in an overall hospital is lesser than that. So, and the patients do get a customized feel compared to a hospital setup. So definitely, we will be at a better edge than the hospital setups in UAE. The newer trends will be the new procedures, and as we know, with newer technologies in case of operations, anesthesia, the operation times have reduced completely, recovery times have reduced. Now operation done by minimal invasive laparoscopic methods or lasers, so definitely these will be the newer trends to push ambulatory day surgery centers.